Hello, my name is Ashley Quanbeck. I'm a family practice doctor at Bighorn Valley Community Health Center. I have been asked today to talk a little bit about fetal development. Medically, we start counting the dates of fetal development, or the dates of the pregnancy really, based on the first day of the last menstrual period. This is because most women can remember when they had their last period. However, this does not actually reflect the start of the pregnancy. Typically, most women ovulate, that means release an egg from the ovaries, approximately 2 weeks after the first day of their last menstrual period. If sperm is present during the 24 to 48 hours after ovulation, fertilization then can occur. Most fertilization occurs in the fallopian tube. Once fertilized, the egg begins to divide and travels down the fallopian tube into the uterus, where it begins the process called implantation. During implantation, the egg burrows into the uterine wall and begins to produce the pregnancy hormone called HCG. This is the hormone that can be detected by a urine pregnancy test. The pregnancy hormone then signals the ovaries to stop releasing more eggs and to begin the development of the placenta, which will provide nutrition for the baby throughout the pregnancy. All of this occurs in the first 4 weeks, which is before most women even know that they are pregnant. By week 5, the circulatory system begins to develop, and the baby's heart begins to beat. It's around this time that a pregnancy test will first begin to show positive. During week 6, the mouth, nose, and ears are beginning to take shape. The intestines develop. By week 7, the arm and leg buds begin to show. And by week 8, the nervous system has developed enough that the baby begins to move, just a little bit, and you won't feel it yet because he or she is still so very small, about the size of a kidney bean. Early in pregnancy, babies are all about the same size regardless of the size of their parents. Thus, the measurement of the baby between 8 and 10 weeks reflects how many weeks old the baby is, not how tall mom or dad is. This is why an ultrasound done at 8 to 12 weeks of pregnancy is much more accurate for determining the age of the pregnancy than one done later. From 8 to 12 weeks, baby grows in size and his or her features become more and more clear. By 12 weeks, the baby's reflexes start. He or she will open and close his fingers, kick his feet, and make sucking motions with his or her mouth. Between 12 and 16 weeks, baby continues to grow stronger, and by 16 weeks, baby is about the size of an avocado. His or her legs are strong enough that you may begin to feel him kick. While her eyes are still fused shut, she can detect light. If you shine a flashlight on your belly, he or she will move away from the beam of light. Between 16 and 20 weeks, baby continues to grow as his senses develop. And by 20 weeks, he or she may be able to hear your voice. Also by 20 weeks, her digestive tract is beginning to work and forming the first poop that she will have after birth. By 20 weeks, all the structures that make this tiny group of cells into a baby have developed. And this is why most doctors recommend a second ultrasound between 20 and 22 weeks. This allows us to check out the heart, the lungs, the brain, the kidneys, the intestines, the placenta, and the umbilical cord to make sure that everything is developing the way that it should. Now that baby has all of its parts, the second half of the pregnancy, from 20 to 40 weeks, is all about growth. By 30 weeks, baby is the size of a coconut and begins to develop a layer of protective fat called brown fat. This is a unique type of fat that is special to newborns. It is very rich in nutrients and serves to provide the baby with nutrition after birth while waiting for the mother's milk to come in. Between 32 and 40 weeks, most women gain about a pound a week. Half of that goes directly to baby. Babies gain half of their birth weight in the last 8 weeks of development. By 36 weeks of age, baby looks like a newborn, but he or she is not ready for the outside world quite yet. His or her brain and lungs continue to develop in these last 4 weeks of pregnancy, so it is very important to be patient and give him or her a chance to reach full development before delivery. At 39 weeks, your baby is considered term, meaning that his or her development is complete and it's safe for them to be born. Babies, however, have minds of their own and will come on their own time. If you don't go into labor on your own by 41 weeks, however, your doctor may talk to you about inducing labor with medications, as pregnancies that go past 41 weeks can be unsafe for mom or baby. That said, most women will go into labor on their own before 41 weeks. And there you have it, pregnancy from conception to delivery. While it might seem like a long 9 months, so much goes into the growing of a new human being, and before you know it, your baby will be here. Thank you so much for joining us today for this Bloom session on fetal development. We hope this information was helpful, and we welcome comments on the thread below. If at any time you have specific questions about your own pregnancy, please be sure to reach out to your healthcare provider.